Okay, everybody. Well, welcome to this weekend edition of Asking a Spine Surgeon Questions. My background, once again, is I'm a spine surgeon in the same place that I grew up, Dallas, Texas, right in the middle of America. And sometimes on the weekends, usually about 20 minutes at a time, I kind of jokingly say, so my kiddos are napping, I'll jump on and do a live session. So we kind of get a couple of things going. I'll answer questions. I'll go over different topics. And the thing I like to start on is just seeing if people can understand some anatomy aspects of the spine. So, as a reminder, it goes disc, bone, disc. This is the lumbar spine. There's 5 bones in the lumbar spine. Some people have 6, to be fair. And then the cervical spine, there are 7. So, uh, sorry, the cervical spine, there's 7. So there's different ways people get back pain. There's different reasons people get back pain. And what I'm going to go over today is a couple different topics. I'm going to try to answer some questions. I'm going to go over disc replacements. I'm going to go over, that's lumbar. We have cervical disc replacements, A-lift cages, go over different techniques, different technologies, and kind of go from there. So if anyone has any questions, kind of type them in, and I can kind of go over different topics and just kind of see what is best. So let me hit this here and we'll go over that. Perfect, perfect, perfect. Okay, so the best fix for lower spine arthritis. So look, having arthritis isn't the problem necessarily. Arthritis, I usually use this analogy to my patients. It's like having a callus formation on our hands. You can get the same thing on your disc where these are the joints on the back, the facets. So when they rub, get wear and tear, they can grow extra tissue. When it grows in the back part, that's the muscle. That's okay. Not a big deal. That hurts, but it's okay. When that thickened tissue grows and pinches the nerve, that's pretty much what foraminal stenosis is. Foramen is a hole. It's a Greek or Latin kind of same difference for hole in the bone. That's what the foramen are. It's like a tunnel where the nerve comes out, and they can get squeezed either from a disc herniation, they can get squeezed from this thing called spondylolisthesis, and then get squeezed from spinal stenosis. So looking down the tunnel, squeezing of those nerves there. Those are kind of the 3 things that could cause spinal stenosis. Let me go over a couple questions here from our fun fam. Can you reverse degenerative disc disease? Not really. You kind of treat it. You can stop the progression, which is a big deal. Some of the things that worsen degenerative disc disease is certain diets. I'm not at all going to pretend to be an expert on that, but I think there is a fair argument of anti-inflammatory diets and inflammatory diets kind of adding to back pain. That's a little outside of my scope, but I've had many patients anecdotally tell me that they dropped certain red meats, alcohol, inflammatory things in their diet, and that helps. Okay, but the more important thing is weight control. You want to have a healthy BMI, body mass index, controlling your diabetes, smoking, and certain mechanical stressors. Certain people's jobs just creates wear and tear. So that's hard to change. There's also certain activities or recreational activities you might be doing that are kind of wearing out your spine. A couple other questions here I'm trying to read. Is there any treatments for scoliosis? There's a couple treatments. There's tethering, that's more for kids. The literature is a little mixed on that, but for adults, in terms of scoliosis, kind of the newer thoughts are instead of treating the whole spine, maybe you just treat one level. It's called like treating the fractional curve, fraction like fractionals. So that's a question. My thoughts on viral meningitis. Don't have a ton of viral meningitis thoughts to add there. I know it's becoming more of a topic right now in America from EEE. I forget what that stands for. It's like something encephalitis. I forget the other E's are. That's pretty much a mosquito. A little beside, getting way off topic here, but that's my thoughts on viral meningitis. Nick, good to see you. Thanks for the comment. And I do encourage, I have a lot of former patients in these chats, and I just encourage you guys can even direct message each other and just talk about your experience, how things have got better. I think it's just a great role of social media is actually connecting with people that might be having the same issue as you. So if you see someone mentioning that they're a former patient or something like that, I can't confirm or deny, but you can kind of go there. From HM2085, can you regrow somehow the disc height? Not really. You can get more hydration in the disc. That's minuscule. That's really the main way you could do it. Why do some doctors not recommend lumbar disc replacements? Well, it's really a loaded argument. How about this? Lumbar disc replacements just have a very narrow indication, and some patients that want it aren't the best candidates for it. And that's kind of the quick way to answer it. There's other ways where it's instability, and that's another thing. Another thing I sometimes point out, you can argue it either way with lumbar disc replacements. So here's a one-level lumbar disc replacement. Is if these have issues, like if they come loose or they are put in a little off balance, something like that, in the cervical spine and the neck, they're actually relatively easy to revise, to take out and do a new one, or to take out and do a fusion. And it's not that crazy of a procedure, honestly. It's not that big of a deal. It sucks. It's another surgery, but hear me out. In the lumbar spine, it's a huge deal. In fact, at L4, L5, where you have to pull the vessels to the side, it's that's one of the most dangerous surgeries that we can do. So really, the way you can avoid that is avoiding disc arthroplasties there, unless you're, willing to go back and they're doing revision. It's just a big hairy deal. Some people say at L5S1, well, that's where the vessels split, and so then you have this gap here. Some people argue you shouldn't do disc replacements at 5-1 because that's the foundation, and that's a good A-lift level where you get the curvature, the lordosis. And some people say it's great at either level. Some people say it's bad at either level. So a lot of long answer there. More B3, but I hope that kind of answers some of your questions. I didn't know Dr. Gill retired. If you're talking about Dr. Gill at UT Southwestern, that's news to me. I thought extremely highly of him when I was doing an away rotation. He said some extremely flattering things to me. If that's the same Dr. Gill, and I always thought very highly of Dr. Gill. So congrats on his retirement. If that's the Dr. Gill you're saying that retired in Dallas. Getting some other questions here from Tammy. What do you think about the mild procedure for spinal stenosis? I have a lot of mixed feelings on that, Tammy. My argument in short is if you're going to have a spine surgery, have a spine surgeon do it. The mild procedure is one of those things that was like developed by spine surgeons. And now only pain management doctors do it for the most part. It's more of a marketing catchphrase thing. People really should just get a laminectomy, not a mild procedure. Like it's just pretty much you're talking about shaving off just like a little piece of tissue here on someone who doesn't really know how to do spine surgery, like a pain management doctor, which they shouldn't know how to do spine surgery, right? Like they never went to a surgical residency. Versus a laminectomy, that's you making a bigger hole here or just taking off the lamina. That's a much bigger bang for your buck, but not that much more of a surgery in a way. What's the recovery from bilateral SI fusions? Can you have a normal life after? From Miss Sal or Mr. and Miss Salazar? Yes, you can. So the questions here from Get Me Out of Here. That is, oh, I almost read that thing about your Billy Goat. Goodness gracious. I need to read these before I just read them out loud. From Max, do you suggest a disc bone edema and cervical? Sorry, I don't know what that means. I'm trying to read these questions pretty fast. They come through pretty fast. Will stem cells help rejuvenate the disc in your spine? They'll help with an anti-inflammatory aspect, but they won't regenerate cells yet. We hope they will, but they haven't been able to reverse disc degeneration yet in the neck. Does inversion table help from Real Max? Yes, I think inversion tables do help. There's level 3 evidence on that. I might be a little off on the level 2 or level 3. Moderate bilateral foraminal can barely walk severe pain. L5S1. So L5S1, the foramen are these tunnels. They're squeezing those nerve tunnels, shoots down. L5 usually goes kind of butt, side of the thigh, then wraps around the ankle, top of the foot. S1 is kind of all the way down. Case, hello. Thanks for joining. Wheeze, good to see you. From Love Deep, good to see you. And Vivian, good to see you. From Jennifer, can you fix a bad fusion with screws and rods in 2 weeks post-op? You can, but that's just, if you're only 2 weeks post-op, I would just kind of figure out if you even need another surgery. So I'm just not sure. Case, good to see you. Question from Henry D. What should your comments just cut off? I'm trying to read it. What should your bed be after an SI joint fusion? Enjoy the comment. What should the height? What height should your bed be after an SI joint fusion? Normal height. To be totally transparent, I don't do a ton of SI joint fusions anymore. I used to, but one of my best friends in my spine surgery group is now in my spine surgery, or he's my best friend, and then he joined our spine surgery group. So now he's even more my best friend. Either way, he does a lot of SI joint fusions. I'm happy to share his name. If anyone wants to talk about SI joint issues, I think you should reach out to him. He does telemedicines also. I'm not trying to advertise for me, but I don't mind advertising for him because he's my best buddy. But his name is AJ Rush, letter A, J, and then Rush. If you have any sacroiliac joint issues, SI joint issues, he's your guy. So Henry, I think it's any bed you want. I mean, I do huge scoliosis surgeries that are much bigger, and you can do any bed you want after that. We have about 1,000 people in these chats. So sorry if I miss your comments. You can always direct message me, and I can share a couple things and tell you about how to do telemedicines. But I really don't want this to be an ad. I'll do this for another 20 minutes here. Cujo, Ali, thanks for the follows. Mary, thanks for joining. A couple of questions here. I had a nerve ablation, no relief. What else can be done? Well, those nerve ablations are kind of burning the nerves back here. My question to you, and I can't do the whole routine here, but did it go away for a while and then come back, or was it gone forever? Or sorry, or did it never go away even for a day? If it didn't go away even for a day, then that's probably not your issue, to be fair. It's something where, if you have a cut on your arm, right, and you get some numbing medication on this arm, and you're like, oh, that numbing medication doesn't work. Well, maybe it was put in the wrong spot. If your issue's here and they put it here, you don't say, oh, injections don't work. They just not in the right spot. So not exactly sure if that answers your question, but I would just think about that from the nerve ablation. If you never got one day never got one day of relief, maybe your issue is not coming from that facet or that joint. Question from the Thunder: can a bulging disc get worse? I'm a runner. It can get worse. Usually, it calms down. From Lisa: go Rangers. Yep, I'm not a diehard Rangers fan. Of my 4 Dallas sports teams, probably my 4th favorite of them. I still like them, but my dad gave me that, so obviously that's going to stay up forever. From Raquel: thoughts on epidural steroid injections in the lumbar spine? Got 2 thumbs up. A lot of people talk trash on steroid injections, but they shouldn't. Steroid injections do great. From Wrong Rock: thoughts on PRP? I like PRP. I wish it was covered by insurance. I don't personally do PRP. My only thing I don't like about PRP is usually it's cash and that's expensive, and God knows how much all of y'all are spending on insurance right now. So to do something that's cash, I don't love. But PRP is good from an anti-inflammatory effect. I just think maybe you should just do epidural steroid injections. They're also very good. I don't want to say they're better, but also very good. Why can't they do a kyphoplasty 8 months after a spine fracture? That's a good question. Pretty much the kyphoplasty, what they do is you go, if it's 8 months later, how about this? Think of it this way. Once the bone is healed, you shouldn't do a kyphoplasty. The kyphoplasty fixes healed or fractured bones. The way you know it's fractured is either clinical exam, but usually it's also an MRI. There's an image on there called the STIR image, STIR. I just put up a video today on how to read your MRI, so you can go check that out. And if there's something called edema, so bright signal, then that means there's water or blood in the bone. That means it's still fresh. Then that could be a good candidate for a kyphoplasty procedure. So that could be one of the reasons. From Stacy: I have a grade 4 spondylolisthesis. Oop, that's my favorite topic. So let me scroll back down to that. It just went away. Again, tell you these coming. Bulging disc. I see a surgeon tomorrow. So Stacy, if I was you, get your X-rays on a CD and then see what they say. I'm always happy to lend a second opinion, but you need your X-rays. X-rays are a big deal. Most people see a spine doctor, they get their MRI on a CD, but I need the X-rays. The X-rays are just as big of a deal. Henry, thank you. You are a good friend. All the wishes. No problem, Henry. Good to talk to you. Henry, Nolan Ryan is one of my favorite pitchers. That's good. Tammy, I've had injections and they help me a lot. Great. Tammy, I appreciate you sending that. From Glenn, what's your thoughts on electric spinal cord stimulators? Mixed thoughts. I'm a little biased. Usually I only see people that get them and they don't work. And that's been why they came to the spine doctor or spine surgeon, to be fair. So I don't see a lot of people that get them and they love it, because if they loved it, then why are they seeing me? You know what I'm saying? So I don't hate them. I don't love them. I just have a lot of mixed thoughts. Sorry. Thanks for the gift. Don't send me gifts though. Save your social media money for other accounts that are doing it to try to make a living. So appreciate it, but don't do it. Do I do surgery on the neck? Of course. I do everything from the skull down to the pelvis. Appreciate the likes, subscriptions, and follows. You can always turn on an alert. So when I jump on these, it'll give you an alert. If you get bored of me, you can always remove it. And I can't do co-shares. I see some people asking in, but I don't know all like the HIPAA or legal laws. If someone tells me their diagnosis online, I guess technically you're not my patient. But so I can't do like live stream consultations. I just don't know the rules on that. Should chiropractors who mess with an infant spine be jailed? From Sean. Oh boy, Sean, I'm being recorded on another stream, so I don't know if I want to put that into words, but I I mean, be jailed, no, but um, I don't see any role for chiropractic manipulation of an infant or a toddler at all. And I'll just kind of leave it at that. Are you familiar with MoGAD? MoGAD. I'm not, Jim, but if you send me a direct message, I'd love to just send me like a Wikipedia link on it. I'd love to learn about it. From Catherine, I have C5, C6 radiculopathy. Should I wait for surgery? So C5 usually goes to the shoulder, sometimes the bicep, and C6 is kind of bicep, forearm, and then these two fingers here, kind of your shooting fingers. The way that I always kind of remembered it in med school is so C5 is shoulder. I guess you have to remember that. There's not a good way. Or how about this? C6 is gun. Like you got your six shooters. This is kind of like way early in med school. You got your six shooters, maybe a Texas thing. C7 is your middle finger. Like you're lucky to get flicked off by someone, is kind of what they said. I know it sounds stupid. So if you remember those two things, okay, great. So then you remember, okay, so eight. Eight's got to be whatever's left. So eight is this stuff. So these two fingers is C8, C7, C6. And then if you know that, working backwards, then bicep, shoulder is C5, then C4. So now you're at the point where obviously you know it, memorize it, and treat it. But that was a good way, kind of as a first or second year med student, try to figure out the different dermatonal patterns. C4-5 will keep you alive. Yep, C4-5 will keep you alive. I think that's the phrenic nerve is what those went to. Go to the floor. I remember those. A lot of these things I had to study really hard in med school to not have to know as much anymore because you don't have to mess with some of that stuff anymore. How soon can you tell if your micro decompression failed? From Carlos. Carlos, I would say, look, the best indications for surgery is shooting down numbness and tingling. So if that got better for a good while and then it came back, I don't 1,000% know if that means it failed. You might just have another area of stenosis, or you could have recurrent stenosis. So I don't know. That doesn't answer your question completely, but if like you woke up, the numbness and tingling never went away, then that's not great, and that might be a different thing. Um, and I usually say, look, numbness and tingling is a little different than pain. Sometimes if the nerves are totally trashed and you've waited forever, if your history of smoking, because that hurts the nerves, if you're significantly older, if you just put it off forever, maybe the numbness and tingling never gets better because those nerves are just dead. There's only so much a spine surgeon can do, but usually doing a decompressive surgery, you take the pressure off the nerve, that's going to help with the pain. The numbness and tingling might persist. So I hope that answers your question. From White Lightning, hey, good to see you. Patricia Butler, having an L4-5 decompression tomorrow, have pain in the butt down the left side of the ankle. Yep, that sounds like the correct dermatonal pattern for L4-5. Good luck, Patricia. All right, getting to a couple other questions here from Tracy. Tracy, good to see you. I see your comments there, and I look forward to talking with you. From Hannah, what step 2 score should I aim for? Golly, I can't even remember. I feel like I don't know. I don't even know what. It's so hard for me to remember about. Oh, they don't have step 1 scores anymore. Now I think about it. I think back in the day, which wasn't crazy long ago, you wanted to step 1 of at least 140, and then your step 2, you always said it was like 10 points higher or 20 points higher. So I think I don't even know mine. I'm not going to sit here and tell you mine, even if I could. Just that sounds very braggadocious, but the scores are very important, and that's unfortunate, but that is also fortunate. You need objective measures to be able to differentiate people. You shouldn't just look at, well, I don't know, certain factors. You need certain scores to identify differences in people, and that stinks and that's tough. But that's just part of life, and that's been like that for a long time. So good luck on your scores. Trying to look at a couple other questions here. I had a laminoplasty and then later laminectomy fusion T12 or C2 to T12. Okay, like to see it. From Samantha, I have SI joint pain. How to help it? Well, doing physical therapy for your SI joint pain is a good way to start. How long does cervical fusions last? Hopefully forever. From Carrie Wilkerson. From David, do you recommend for a ruptured disc? I recommend time, anti-inflammatories, maybe steroid injection. From Taylor, I backed out of severe. I backed. Oh, sorry, I blacked out. Sorry, these come across fast and move up. Try to follow it. I blacked out from severe lumbar decompression pain after squatting. Any ideas what causes it? Maybe a disc herniation. I'm just not sure. What's my best recommendation for bulging disc? Well, first you need an MRI to confirm that's the diagnosis. Then usually resting ice heat. I know that sounds silly, but a lot of people just don't do it. Anti-inflammatories to calm down the inflammation. I think getting with the spine surgeon early is helpful. just because you see a spine surgery doesn't mean you're going to have spine surgery. It's like maybe it's like going to the car dealership. You're just going to see what the options are, but you don't have to do it. And maybe they're gonna. I guess you don't go to a car dealership and they tell you keep the car you have. But surely there's a good analogy out there if anyone wants to help me with one. From Andrew, indications for open versus MIS lumbar laminectomy. It just depends. If you're doing multiple levels, like 3 levels, 4 levels, you could do open, a bunch of perk little incisions. Sometimes open is just, not that much bigger. Those incisions all add up. So it just depends on what the patient. Sometimes actually on bigger, heavier, fatter patients, for lack of better English, MIS is better just because it's the soft tissue that you don't have to disrupt to get through. From David, I see your question there. I would not recommend doing that. I think that's a cash thing where they charge you $15,000, maybe more. Essentially, it's I just don't love it, my friend. I really don't. So I'm sorry, and I'm not just saying that because I like to operate. Look, if I did it, it'd be cash only. I'd work less money. So I'd work less and have money. So I just don't recommend people using that. I just don't want to say that product on here. But I saw your question from Lotus. Did I see your question? No, I didn't. I apologize. A couple other people. Taylor Roberts. I have pelvis and hip diagonal causing worse disc herniation. I recommend chiro. I do recommend chiropractic doctors. I usually say go to maybe a family friend or someone that's seen a chiropractic doctor that they like and trust. Maybe someone that has roots in the area. And the only reason I mention that is you don't want someone that's just kind of a fly by night, moving from practice to practice. I also don't love the idea of like popping your back or paying a crazy amount for manipulations. But I think in terms of like cold water therapy, acupuncture, deep pressure, deep massages. That's a good role. Maybe gentle traction on the lumbar spine. I do support that. I don't support any traction on the neck. When I see chiropractors put up videos about the ring dinger popping of the neck, one, I think it's probably not in America because I can't believe people in the States with our legal system would do that. And then two, that just seems crazy to me. And it seems crazy that those people actually think they're helping. I saw one the other day. If I was more motivated, I was going to make a video of that and then my comments on it. But they were saying the patient has a lumbar disc herniation and they're doing this stuff, towel on the neck and pulling them out. I mean, I just can't even tell you how stupid that is. And I'm sorry to be so rude on that, but it's just like, I wish I could get with that patient and be like, what are you doing? They're so afraid of spine surgeons that they're almost risking their life seeing and paying cash to someone who's about to break their neck. From Big Dog 63, do you not do X lifts? No, I do X lifts all the time. I like laterals. I like X lifts. Here's a lateral cage. I guess technically it's not an X lift cage because that's a Medtronic term, but this is a direct lateral cage. This is from one of their competitors, but goes in and expands open and gives you that lordotic wedge case. So I like laterals. I think laterals are great, especially for fusions at lumbar 2, lumbar 3, lumbar 3, lumbar 4. All righty, I'll get to a couple more questions here. The ring dinger from Henry. Yep. Do annular tears hair on their heal on their own? Yes, they do. Now the problem with annular tears from Tehran Meta is that you might get an MRI. So say you get hurt and you get an MRI and you have an annular tear. There's a chance you get an MRI in 5 years and it still shows up on that. It still shows up as an annular tear. It still shows up white on that thing. So just because you see it on MRI does not necessarily mean it is symptomatic. From HMP2085, why do some spinal fusions fail? What is the solution? That's a good question. Well, look, failure is a bit broad encompassing term. So some of them could fail. And I say fail because like I don't know if I call that a failure, but hear me out. I'm not saying we're perfect or all saints, but it could get infected. So that's a reason. 5% of spine surgeries maybe get infection, and that stinks. And that's usually a second surgery, clean it out, antibiotics. Okay, so that's one reason. Two is they might not fuse, and then there's different reasons things might not fuse. When I say fuse, is look, we connect these with screws in the back and a spacer or a cage in the front. Sometimes you can get something called an occult infection in there, so it's not like pussing out, but it doesn't fuse because it's actually sometimes P. acnes. Although P. acnes was renamed, I forget the new name, but that could be a reason it doesn't fuse. Let me do one thing here. Hit this, and I'll hit a couple things here. Okay, so on that note, I actually do have to go, but I'll finish up this question really quick. So Okay, so I do have to go really quick, but to just jump back onto why do some things fail? Ah, I gotta go. Sorry, everybody. Sometimes duty calls. And with that note, just follow along.